Little Bindi's not that old, but his tooth is pretty diseased, and unfortunately Little Bindi has a very subtle heart murmur that's been getting worse over the last 12 months. So the idea with this dental is if he has any teeth that are in doubt, we would look at removing them versus leaving them. If we leave them and the tooth gets worse, the chances are we may have to anaesthetize him in a few years' time when his heart problem is more severe than it is now. So any borderline teeth we'll look at getting out and hopefully curing his mouth for good, although dental problems are generally progressive, so we will need to watch them as time goes on. Happy with this? What we're doing now is stressing the periodontal ligaments, and you just hold them in a stressed manner for up to 90 seconds and loosen the tooth in the tooth socket. If you just wiggle it madly, you will not break down the ligament. The tooth's designed every time you chew on something hard to put stress on the ligament. So if we rotate that backwards and forwards, we're actually not creating any long-term stress on the ligament. So stress the ligament, hold it there in a stress position for a while, and the tooth will generally make its way loose. So the importance is to try and get the entire root of the tooth, not just if we manage to fracture that little tooth root off at the bottom, this dog could have a draining sinus tract or an abscess of that root tooth long term. So it's critical to get rid of that. And in a 3-root tooth like this upper carnassial, you need to section the tooth into 2 or potentially 3 and remove all 3 roots individually. But that's come out really nicely in this little man. His gums, although there'll be a big hole there, we won't suture that gum line over. That gum line will heal very quickly in time because of the great blood supply to the gums. So I'd expect this little man to be eating tonight soft foods for 2 to 3 days, and then to be eating dry foods again from there on in. The prognosis for this little guy is good. His mouth is actually very good apart from this particular tooth. So it's hard to know what happened to this tooth. It doesn't have a crown fracture, but he may have just traumatized it and damaged it and loosened it, and he's got a significant amount of infection around the gingival margin, and that probably extends to one of the roots. But his mouth, for a dog of his breed, smaller breed dogs have very bad teeth as a rule. His mouth looks pretty good.